The new 2026 cholesterol guidelines are out, and they may change the LDL target for many patients. If you think an LDL of 120 is always fine, the new guideline may surprise you. If you have ever asked, what should my LDL cholesterol be? In this video, I'll explain LDL cholesterol in simple terms, why doctors try to lower it, why your LDL target may be lower now, and how doctors decide LDL target levels under the new LDL Targets 2026. LDL cholesterol is often called bad cholesterol because too much of it can slowly build plaque inside your arteries. Over time, that plaque can increase the risk of heart attack and stroke. So, when doctors treat high LDL or high cholesterol, the goal is not just to improve a lab result. The goal is to reduce heart risk before serious problems happen. That is why treatment may include lifestyle changes, statins, and sometimes other cholesterol medication, depending on your overall risk. And one important idea in the new guideline is this: lower is better, and lower for longer is even better. That is because cholesterol damage can build up quietly over many years. In the past, many patients were mainly told that their cholesterol levels were high and that they should improve diet, exercise more, and maybe start treatment. That is still important. But the new cholesterol guidelines 2026 make one thing much clearer. Doctors are now more specific about how low your LDL cholesterol should go based on your overall risk. So let's look at simple examples. Imagine one person has an LDL cholesterol of 135. They do not have known heart disease, but their overall heart risk is considered borderline or intermediate. In that type of situation, the LDL target may be below 100. So 135 is not just slightly high. It may mean the doctor wants that number lowered by about 35 points or more. Now take a second person. Their LDL cholesterol is 128. They have not had a heart attack or stroke, but they have a higher overall heart risk. In that kind of higher risk group, the LDL target may be below 70. So even though the LDL number may not look dramatically different, the treatment goal is much lower because the risk is higher. And in some higher risk patients, doctors are not only looking at the final target, they may also want a large percentage drop from the starting LDL, sometimes around half in certain situations. Now think about a third example. A person already has cardiovascular disease and is considered very high risk. If their LDL cholesterol is 110, the target may be below 55. That means the goal may be to cut the level by more than half. So this is the key message. Two people can have similar cholesterol levels, but very different LDL targets. Why? Because doctors do not decide treatment based on LDL cholesterol alone. They also look at overall heart risk. That is one of the biggest practical changes in the new LDL Targets 2026. So, how doctors decide LDL target levels is actually simple in principle. First, they measure your LDL cholesterol. Then they look at your overall heart risk. For many adults without known cardiovascular disease, doctors may now use a newer risk tool called PREVENT to help estimate that risk. And if the picture is still unclear, sometimes a calcium score can help guide how aggressive treatment should be. So, if you have ever asked, what should my LDL cholesterol be? The answer is no longer one number for everyone. A lower risk person may be treated toward below 100, a higher risk person may be treated toward below 70, and a very high risk person may be treated toward below 55. So the real question is not only, is my LDL high? It is also, why is my LDL target lower now? And what goal fits my risk level? That is the big takeaway from the new cholesterol guidelines 2026. The higher the heart risk, the lower the LDL target. If this helped make cholesterol numbers easier to understand, please subscribe to Dr. RJ Health and share this video with someone who is trying to understand their LDL report.